Why are so many people fussing about medicine? What are we actually talking about when we say vaccine? Let's take a look. The picture that comes to my mind when I think of vaccine is the one that I got as a child. They are beat up and dead versions of the disease for your body to practice on, so you can build up what are known as antibodies. While I do not claim to understand what this article from ScienceDirect.com fully says, what I do see is that I have a very immature and ignorant understanding of what vaccines actually are. The subject is huge and needs deconstructed. I do not plan to cover every aspect, but more of a 101 on the topic. Most people who are in the anti-vaccination camp are not against vaccine science, but the current schedule of vaccines administered to children with no dose changes or time changes due to unforeseen circumstances. For example, a premature baby will be given the same shot as a healthy weighted baby. As you can see from the CDC's own fact sheet, the modern schedule will pump over 25 doses of vaccines into a child before it is a year and a half old. Another part of this issue is the ingredients. From aluminum to formaldehyde and even mercury. All of these are in the shots being pushed directly into the bloodstream of all of our infants. Even though we are shooting them up 25 times in 18 months, their reasoning for having mercury in the shot is so they can cram 3 shots into one, called the MMR, measles, mumps, rubella shot. If these were given separate, according to their logic for using thimerosal, we could administer them separately with no heavy metals. Now, let's just look at how our government is set up to deal with people who have issues with and have been affected by these vaccines.
Had Eric been harmed by a pharmaceutical product other than vaccines, his parents could sue the manufacturer in civil court, entitling them to the standard legal process with a judge, jury, private attorneys, legal precedent, and discovery, all within public view. But for kids like Eric, the National Childhood Vaccine Injury Act says no. Instead of suing the pharmaceutical company directly, parents of children like Eric are forced to petition the Department of Health and Human Services, and if federal health officials oppose compensation, the case is argued before a special master in the U.S. Claims Court. Many refer to this as vaccine court, though it isn't a court at all, but rather an administrative procedure in which the family asks the government to admit the vaccine caused their child harm and requests compensation for the child's care. Here are some shocking facts about the so-called vaccine court. Pharmaceutical companies do not have to participate in the proceedings at all. Taxpayers pay for all damages. The U.S. Department of Justice acts as the government's lawyer, with taxpayers footing the bill for their defense.
In the 1970s, the U.S. government inoculated the public for a swine flu epidemic that never happened, with a vaccine that was never tested, while providing the population with information about a tested vaccine. The results? More confirmed cases of neurological disorder, Guillain-Barré's, than there were of the actual swine flu. Check out this ABC clip.
Flu season is upon us. Which type will we worry about this year? And what kind of shots will we be told to take? Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot.
One of those who did roll up her sleeve was Judy Roberts. She was perfectly healthy, an active woman, when in November of 1976, she took her shot. 2 weeks later, she says, she began to feel a numbness starting up her legs.
I joked about it at that time. I said I'll be numb to the knees by Friday if this keeps up. By the following week, I was totally paralyzed.
The diagnosis? a neurological disorder called Guillain-Barré syndrome, GBS for short.
The rationale for our recommendation was not on the basis of the death of a single individual, but it was on the basis that when we do see a change in the characteristics of the influenza virus, it is a massive public health problem in this country.
Dr. David Sensor, then head of the CDC, the Center for Disease Control in Atlanta, is now in private industry. He devised the swine flu program, and he pushed it.
You began to give flu shots to the American people in October of 76.
October 1st.
By that time, how many cases of swine flu around the world had been reported?
There had been several reported, but none confirmed.
Did you ever uncover any other outbreaks of swine flu anywhere in the world?
No.
Giving the public all the information it needed about the swine flu shot. This form stated that the swine flu vaccine had been tested. What it didn't say was that after those tests were completed, the scientists developed another vaccine. And that was the one given to most of the 46 million who took the shot. That vaccine was called X53A.
Was X53A ever field tested?
I can't say. I would have to...
It wasn't.
I don't know.
Well, I would think that you're in charge of the program.
I would have to check the records. I haven't looked at this in some time.
Did anyone ever come to you and say, you know something, fellas? There's the possibility of neurological damage if you get into a mass immunization program?
No.
No one ever did?
No.
Do you know Michael Hatwick?
Yes. Mm-hmm.
Dr. Michael Hatwick directed the surveillance team for the swine flu program at the CDC. His job was to find out what possible complications could arise from taking the shot and to report his findings to those in charge.
Did you know ahead of time, Dr. Hatwick, that there had been case reports of neurological disorders, neurological illness, apparently associated with the injection of influenza vaccine?
Absolutely.
You did?
Yes.
How'd you know that?
By review of the literature.
So you told your superiors, the men in charge of the swine flu immunization program, about the possibility of neurological disorders?
Absolutely.
I've said that Dr. Hatwick had never told me of his feelings on this subject.
And he's lying.
I guess you would have to make that assumption.
Then why does this report from your own agency, dated July 1976, list neurological complications as a possibility?
I think the consensus of the scientific community was that the evidence relating neurologic disorders to influenza immunization was such that they did not feel that this association was a real one.
You didn't feel it was necessary to tell American people that information?
I think that over the years we have tried to inform the American people as fully as possible.
These vaccines that we are told are completely safe and effective have a different esoteric background. This next clip is from the cutting room floor version of an interview done with one of the forefathers of vaccine, Dr. Maurice Heilman.
Among the discoveries he made at Merck are vaccines for mumps, rubella, and measles.
Tell me how you found SV40 in the polio vaccine.
Well, that was a Merck thing. Okay. Yeah, I came to Merck, and I was going to develop vaccines. And we had wild viruses in those days. Remember the wild monkey kidney viruses? And so you go ahead, get your monkeys out of West Africa, get the African green, bring them into Madrid, unload them there. There were no other traffic through there for animals. Fly them into Philadelphia, pick them up. Or fly them into New York and pick them up. Right off the airplane. So I brought African greens in. I didn't know we were importing AIDS virus at the time.
And it was you who introduced AIDS virus to the country.
Merck will do to develop a vaccine.
So
what did he say?
Well, he said basically that this is just another obfuscation that is going to upset vaccines. And I said, well, you know, you're absolutely right. But I said, we have a new era here. We have a new era of a detection. And the important thing is to get rid of these viruses.
Why would he call it an obfuscation if it was a virus that was contaminating the vaccine?
Because, there are 40 different viruses in these vaccines anyway that we were inactivating. And
but you weren't inactivating his, though.
That's correct. No, that's right. But yellow fever vaccine had leukemia virus in it, and, this is in the days of very crude science. It's different. I don't know why to tell you this, but I've been around biology a long time. I just think this virus may have some long-term effects. And he said, what? I said, cancer.
I love it.
And
I love it. Go ahead.
Because the day and the jokes that were going around was, gee, we would win the Olympics because the Russians would all be loaded down with tumors. This is where the vaccine was being tested.
Why didn't this get out in the press?
Well, I guess it did. I don't remember. We had no press release on it, obviously. You don't go out. This is a scientific affair within the scientific community.
Not only are these admissions gross, but the demeanor and the audience reactions are quite demonic. One thing to take away from this clip is how he said that it was a problem of science, the superclass, and there is no reason to let the underclass or the general public know. This was brought out in the interview with Dr. Spencer as well. Are we to assume these egotistical arrogances have just disappeared on their own? I don't. Let us look at some less known effect facts about vaccines. Did you know that on a good year, the flu shot was only effective in 1 out of every 33rd person? And in the 2014-15 season, they had to admit that it had little to no effect at all. Quotes from ABC News like, "Flu shot vaccine may not be effective for this year's strains, CDC says." When in fact, this statement should be stressed every year for the 32 out of 33 people that got injected for absolutely no benefit. If the flu shot was the only line of defense against the flu, I would be a little bit more in favor of this. But it's not the case. There have been multiple studies showing that vitamin D3 supplementation is hundreds of times more effective than the flu shot. The only negative response I've ever heard to these studies are that they are not big enough. But think about who has the resources to fund large, expensive studies. The same people that are making huge profits off of the flu shot. And how is it helping the kids? If this vaccine schedule is working, then we should have the least amount of dead children, right? Sadly enough, this is not the fact. This study shows a significant correlation between increasing number of vaccine doses and increasing infant mortality rates. I find it concerning that people are not aware of this in the general public, but I must go back to the demonic old man saying that cancer-causing agents in the vaccines are of no concern to the general public.